Hey, welcome to episode 3 of Now What, an on-demand panel discussion series about how the present and future of healthcare marketing are changing right before our eyes and what to do about it. This series is produced by the Shift.Health Network, the infotainment media network for healthcare marketers to challenge their way of thinking and lead meaningful change. I'm Jared Johnson, digital business strategy consultant and host of the Healthcare Rap podcast, where we rap about challenging the status quo in healthcare marketing. With me today are Paul Griffiths, General Manager for Digital Health Solutions at Perficient, Kristi Ebong, SVP of Corporate Strategy at Orbita, and Chris Hemphill, Director of Client AI and Ops at SymphonyRM. Thank you all for joining the panel today. But in the first episode, I spoke with Paul Soblowski and John Marzano about how the COVID-19 pandemic is a catalyst for change in healthcare marketing and communications. And in the second episode, I spoke with Dan Dunlop and Haley Height on starting points for your post-pandemic plan. And in this episode, we are doing a digital deep dive. We're looking at how COVID-19 is accelerating MarTech strategies for healthcare organizations. So let me set the stage again once more real quickly about the new reality of healthcare marketing, because I don't think we can talk about this enough right now. We're all trying to discover it and realize it all at the same time. The fact is, healthcare marketing was already going through transformative changes, as you all know, over the last few years. Most of you were involved in them very deeply. Many of you are looking already to optimize your marketing efforts to address the rapidly changing expectations of consumers. And this likely involved the rise of your MarTech strategy, where you identified needs for your tech stack, the talent that was needed to manage that stack, and digital investment strategies around it. And then COVID-19 happened, and it has put those needs on a rocket ship and accelerated the rise of digital. In the chaos that's ensued, it has become clear that digital tools are not a side project, they're not a bolt-on strategy, they're not something for the junior team members to explore. It is and should be at the forefront of your engagement strategy, period. And, as every day has been just a pure whirlwind of exhaustion, it feels like it can be hard to know what lessons about digital to take with you moving forward. And that's why we've got our panel today. So we're going to talk about some of the goals of digital and lessons we've learned about the tools that are available. So let's dive right in here. Paul, I'm going to start with you in this one, and then we'll go with Kristi and then Chris, if you don't mind. This first question's for you, Paul. What are we learning about the digital healthcare consumer experience from the pandemic, and what lessons do we need to remember following the pandemic?
Yeah, great question. I mean, I think the first and maybe the good news, because I think at this time it's helpful to start with good news. Hospitals are the trusted resource. So any data, any stats that I've seen in this time, people are actually turning to hospitals and saying, help me understand what care options I have. So I think that's really positive. I think second, it really exposes the challenges of not having a unified view of the patient, that as we're seeing telemedicine and virtual visits and all these things being stood up in weeks, not months or years, that it's kind of exposing these gaps that previously maybe organizations knew about, but understanding what a patient record looks like, or how to communicate with patients, or how to reach them is becoming really critical. So for most of our clients who are hospitals and health plans in the United States, all dealing with this at various waves, the first challenge that I think they're running into is, what do I do now that my traditional forms of marketing and communications just aren't working right now? So I think that most healthcare organizations talk about at a service line level, or they're talking about really elective surgeries. Those have been canceled. So marketing departments now not only don't have the inventory of patient resources that they used to have, they're in kind of crisis communication mode, and not being able to segment out and communicate clearly to patients is a challenge. So we've been tracking and kind of blogging about what people should be doing every week. One of the most interesting ones that has come back from our consumer research is just being clear on things like locations. Is a location open? Is it a healthy only location? Meaning, are you not seeing people who are being treated with COVID-19? Because that's a challenge. Is it a testing facility, or is it closed? And those seem like pretty basic pieces of communication. But if you realize most hospitals are struggling to communicate directly with the populations that are affected, I think that's the challenge. I'll end on an optimistic note because, again, I want to be optimistic in this time. So I think given that hospitals are trusted sources and now realizing that the hospitals don't really understand a kind of unified patient view and can act on it consistently, I think the opportunity then is to think about how to use these digital marketing tools to segment and communicate with people. So some of our clients have shifted now to virtual visits because they're fortunate to be able to offer virtual visits now across different service lines, and they need to be able to communicate with specific groups. So, for example, if a primary care practice is going virtual and now doing online appointments, being able to really communicate with the people who are the patients who are seen in that primary care practice, or specifically who are seen by an individual doctor. So this idea that that segmentation was really about driving what was really being used for kind of service line marketing or surgeries that were elective. I think now this has taught us that ability to have one-on-one personalized communications with patients is critical at times of radical change like this. So I think that has moved from a nice to have to a must have to be able to kind of manage what's now truly a digital healthcare landscape.
Nice. Kristi, what do you think?
Yeah, no, first of all, I'm just excited to listen to Paul. I worked closely with his teams when I was at Cedars-Sinai, and they do really cutting edge work. What's interesting is we are seeing a funny convergence between what's typically the private commercial side of the healthcare world and the public entities. And so in a public health crisis, like what we are navigating now, what you're seeing is some of the typical solutions from the private sector that maybe were focused on the digitally literate, the folks who have access to the latest technologies. We're recognizing that a lot of the most at-risk individuals in the COVID-19 crisis are in fact the aging populations, many of whom still use just their landline or an analog phone. Increasingly smart speaker adoption, which is interesting, having skipped other digital adoptions. And then also a lot of folks who may not have access to traditional digital tools. And so what we're trying to do is figure out for the provider systems, for the payers out there, how do you increase access to all of your constituents, all of your patients? And we're looking at that for offloading call centers, for providing content and having the marketing and comms teams to really provide broad access content across channels. So whether that's you call in via phone to the hotline and you can ask questions to understand your risk, whether that's you have an outbound phone campaign or SMS campaign or a chatbot that you send to at-risk patient populations. And so to Paul's point about segmenting by patient population, but then the ability, how do you democratize the ability to control that content to either a business user on the marketing team or a clinical user who's over a service line? So for example, if I'm over an oncology center of excellence and especially my immunocompromised patients are really at risk during this time, how do I control the content that goes out to them that may be different than the 30-year-old who's feeling okay or has a cough but otherwise is pretty low risk? And so I think the opportunities around segmentation and around doing that through an omni-channel approach are spectacular. The critical need now is how do you democratize the ability to control that content to the folks that are truly specialized in those areas so that you can reach all patients.
Great. Yeah. Really very interesting. These are things that we just have to keep thinking about. Chris, what do you think?
I like the points that you guys have both made. And what really stands out, I want to go back to something Paul said about patients and consumers seeing their healthcare providers as the most important contact in their market. There's a lot of trust in those communications. And when you go into, if you start looking at this as a way to take a new approach to segment accordingly, to make sure that the right communications are going to the right people. And at the same time, the flip side of the reverse of that is that the wrong communications don't go out to people that don't need them. That's a path to start helping marketing regain trust in communities. So I think it's very important to think about which communications go to the right people, which services are online and offline, and how basically marketers can make sure that communication is accurate on basically for capacity availability. But what I was really trying to get at is that as services go offline and as hospitals have to redirect different inpatient services or outpatient services to different modalities, in the finance department, the CFO is still being tasked with maintaining cash flow. Well, at the same time, there's switches in operations and things like that, and ultimately that segmentation ability and digital ability to monitor capacity across the healthcare enterprise. Ultimately, the idea there would be to getting to making sure that we're directing the communications accordingly based on not only the patient need but also what's available from the hospital.
Yeah, it's a really good point. And we tend to just think of one of those or the other, it seems like. I mean, definitely in my client-side experience, we would tend to think one or the other. We wouldn't think about what we needed and what's available, and really to make, like, there just wasn't much QA going on, I guess, in the whole process. And so, yeah, it was always interesting. All right, next question. Kristi, you're up first on this one. Then we'll do Chris and then Paul. So Kristi, what have you seen with chatbots and voice in response to the outbreak? And what do we need to keep in mind about those technologies in particular as the pandemic subsides?
Yeah, it's a great question. I mean, to go with Paul's optimism, I think we've seen broad deployments of chatbots across the industry at a rapid pace, which is something none of us expected even a month or two ago. So that's fantastic. I think folks are familiar with the technology. It's easy to use. I think the challenge that a lot of providers and payers and other healthcare frontline folks are seeing is that when you make these investments, if you're investing in a point solution up front, are you going to end up with a lot of point solutions down the road? And so one of the challenges, and we saw this with electronic health records, right? We've seen this in every industry where some of the early adoption is a point solution here or there. And that's because they solve specific problems. So that's good. It means there's a market demand and there's buyers out there for them. The challenge is once you start investing in, you've got a chatbot for your website, you've got a chatbot for your oncology center, you're using an SMS tool for another post-acute program. And so it wouldn't be surprising to me if CIOs are facing the same conundrum that they faced with other digital technologies in the last 10 to 15 years, and ultimately started looking towards what are the true platforms that are scalable. And so you're making a future-proof investment as you go. And the challenge right now is you don't have the privilege of tons of diligence, right? Technical diligence and what have you, when you're trying to get something up and running really quickly to manage this crazy crisis. And so I think that's where the disciplined buyers are going to continue to lead the marketplace, show those perspectives, looking at who's able to really provide that flexibility and extensibility across the enterprise, and to meet, as I mentioned earlier, the needs of diverse patient populations, regardless of whether, is my 92-year-old physician grandfather going to go to a website to do a chatbot? Probably not. But if you send him an outbound phone call, or ironically, he can engage with an Alexa skill, he's very amenable to those things. And so we need to be keeping that in mind as we extend to meet the needs of all of those patient populations.
Great. Chris, what do you think?
I think the chatbots that have come online, it's just really awesome to see everybody responding so fast and providing tools available for those needs. And just continuing down that path as people get comfortable and get adjusted to using chatbots, I'd actually like to see a little bit more integration of chatbots into back-end records. So one thing that comes to mind is what chatbots are usually tasked to do is what they're concerned with is monitoring what somebody's intent is when they're doing a communication, and ultimately what entities in that, what can actually be done about that intent. So if we're looking at chatbots as we have patient records, we have other things that we're accessing online. If we're looking at chatbots as another path into a personalized care experience, Then when people have questions about COVID-19, and I've seen a bunch of these chatbots, and a lot of it is based on kind of like decision trees, if this, then that, if this, then that, if this, then that, over and over again. But we can start reducing the number of questions that we're asking for all kinds of things outside of just COVID-19, but all kinds of things. If we're making it contextual based on the patient and applying some intelligence there, then it reduces the amount of back and forth that they're having to do it with the chatbot, with the IVR system, or what have you. And ultimately, as people are being acclimated to this, and this could be kind of a prime moment, we could start providing more of a service that way.
Excellent. Paul, what's your take?
I think from a chatbot perspective, we've had clients who've been using them for a while, and mostly our role is externally advising them and making sure that we're building comprehensive strategies and solutions for them. I think there's 3 different types of chatbots, and it's interesting watching the technology drive the usage, because I think everyone is scrambling to figure out how to communicate this. And I think the 3 different really modes of chatbot. There are navigational chatbots. Help me find something on this website. Help me do this better. I don't have time. That's really kind of trying to get people to the point of a decision. So those are like the assessment chatbots. We stood up one in partnership with a company, Drift, who does conversational chatbots, and it was largely that decision tree you're talking about. So there are kind of simple navigational ones. There are call center or customer service chatbots where you're starting a conversation, and then if you need to, you can kind of kick it up to a phone line. Those require staffing and call center augments. So those are a little bit more challenging, but we've seen some people execute on those. Notably, Salesforce gave away some licenses for its cloud service, for its Service Cloud and Health Cloud, to be able to help staff that. So there's an awareness that it's creating kind of strains on the call center. And the third is kind of medical triage, where you're now trying to take medically accurate information and have something backed by an ICD-10 code. Microsoft HealthBot was most notable with that, so some clients launching that. And I think all 3 of those are 3 very different chatbots, and you probably think of different tools behind them, and they've all kind of converged with COVID. So I think what has happened is a crisis has forced issues of navigation. So largely our assessment was realizing that hospitals just need to be able to tell people where to go, and that information is changing on a daily basis. So there is a navigational component. There's a call center component. Part of the reason why I think people were desperate to get them launched is we had clients who had 300 calls, in a queue when the virus started to hit their affected regions. And the third, the kind of medically accurate, is now everyone's trying to figure out how do I get people to just stay home or not trying to engage in the healthcare system who are well. And so what's interesting about this crisis, it's kind of pushed those 3 different ways of thinking about how to engage with someone through these technologies, and really sped up the maturity of that. Now we need to think about that. So we've been now tracking something like SMS or 2-way communications through technologies like Twilio, where you're now talking about interoperability and seeing that you could think about your website and your mobile app and your CRM and all of that separately. And now what's happening is you need to think about them all consistently across the enterprise, and that requires a strategic understanding as well as a technical understanding. And I think that kind of system-wide approach is what's going to happen when everyone kind of takes a deep breath. So I think people stood up what they could. The storm is coming, and then after the storm, you're going to see a lot of organizations take stock of what they have and decide, okay, this really worked for us. We got to keep this, and this system did not. And there's going to be a lot of changes, once I think the COVID crisis is beyond us, because these technologies, some of which promise great results, I think now are having to deliver it. So it'll be a very interesting time after that.
I can definitely see that. So once again, you're tuned into Now What, an on-demand panel discussion series about how the present and future of healthcare marketing are changing right before our eyes and what to do about it. This series is produced by the Shift.Health Network, the infotainment media network for healthcare marketers to change their way of thinking and lead meaningful change. I'm here with Paul Griffiths, Kristi Ebong, and Chris Hemphill. Chris, we're going to start with you on this one. What about CRM? So how does that play into things, right? So what have we learned about CRM platforms during the crisis, and how should this affect our CRM strategy after the pandemic?
The way I look at CRMs is that, I mean, it's a technology that's been around for a very long time, and then kind of made a headway into healthcare in the late 2000s. But fundamentally, the concept of having a system of record that unifies information from EMR systems, from consumer data systems, and from other systems, having a unified view of that, having a unified view of the patient has been something that's been in place for a very long time. The question then, where any kind of CRM vendor or any kind of data vendor, where they're tasked, is how resilient are they to changes? Like once you have a unified view of the patient, the question then becomes, what do you do? I know I have all this information about this particular patient. I have, like, as soon as somebody calls into the call center, I have their entire history that exists in our marketing automation system, those interactions, the interactions that they've had with EMR. But there, at some point, it becomes so much data and so much information overload that people at the call center, people like end users at the call center, people who are making decisions on campaigns, people who are making decisions on what kind of communications to send out for things like revenue cycle and collections, that all becomes a very confusing world, even with the unified view of the patient. So CRM, I kind of look at that as an endpoint of that facilitates some kind of interaction. So you have your CRM type players like Microsoft Dynamics and Salesforce that facilitate a lot of call center interactions or access to data. Then you have like even a marketing automation system. I consider that largely in that CRM wheelhouse because it's still taking data on patients and consumers and helping to make decisions on what kind of campaigns to involve people in or what kind of communications to send out. So when we have a crisis like this, we have all this data in one place, we have these unified views, but the real intelligence, like what's important now about a CRM is like it's well established, it's a technology that's existed for a long time. But the question is, how do we prioritize our outreach? Point I was making earlier, when services are being shut down and other services are being reprioritized, how do we make sure that we're safely getting the right people to the right service lines? There's all kinds of information, all kinds of interaction data that says this person's more likely to respond to a text message related to this topic, or this person doesn't need communication on this topic, but they do need their preferences, a phone call on this topic. So the question then is the question that marketers or anybody who's engaging with the CRM might have about what they're wanting to do, what they want the technology to do, is to be resilient to different types of change. So perfect example is with the onset of COVID-19, we started seeing new procedure codes and ICD-10 codes that are related to that particular illness. That means that like when we're talking about a brand new code, that means that there's no prior data, there's no machine learning model or anything like that already developed. It's really a question of how quickly can our data vendor get us access to understanding how to use these codes and how to make sure that we're identifying the right patients. In that scenario, I mean, you might have the technology there, you might have the latest and greatest features and all that, but when it comes to the intelligence layer, with the CRM, especially in healthcare, you're going for the capabilities, you're going for the outreach capabilities, but also it's important to consider that the partner that you're working with has clinical expertise that's aligned with the data science team or aligned with their data management team, so that so that outreach and communications and so that patient prioritization is based on real either best practices or clinically validated data. So with CRM, I kind of lean more like the technology's there and existing calls that it's in place in all kinds of different workflows. But the important part that I consider is do you have a mechanism in place? Is there data science in place? And is there clinical expertise among the data science team to make sure that you're truly sending relevant communications, especially when it's something so critical as COVID-19.
I like how you thought and focused on the being relevant and not just using it because we got it and understanding truly where the power of it is. Paul, what's your take on CRM and lessons learned from the crisis?
Yeah, I used to have a pretty good talk track on the challenges that digital healthcare posed for hospitals. That if you think about how consumers interact and how we interact, we're used to technology that's easy. We're used to technology that is kind of sticky, and we're used to technology that's pervasive. Meaning, when I use an app on my phone, something like Google Maps, and I switch to my desktop, it remembers who I am. It has kind of preloaded some of the interactions and some of the routes that I've taken, and it's kind of anticipating my next need. And I used to talk about that by contrast of how hospitals didn't make it easy to see care. It was challenging to lose information, so they weren't trying to kind of build an experience, and it wasn't always on or always available. And I think the thing that has happened that I don't expect to change is virtual visits and telemedicine. I think we have fundamentally shifted the way that hospitals and physicians can interact with patients. And I think the whole care model, which there's been resistance to disruption, has now been thoroughly disrupted. And if I play that out into the power of something like a CRM tool, where you're really getting the right message to the right patient at the right time, and you have the ability to close that loop now with an on-demand visit. And I'm not just talking about urgent care. I think the model for delivering health in a digital way is really being rethought live every day now. I think you're going to find that a lot of things that we felt like required office visits maybe don't. And when you get to that level of maturity so quickly, then a tool like a CRM, where you're looking at data and you're trying to understand what treatment options a patient should follow, and now you can deliver that care without them having to sign up or wait, and you can start to push that. I think that's going to be really transformative. And again, sorry to be optimist on the call. I think coming out of that will actually help hospitals be able to manage chronic care conditions at a distance in a way that they just couldn't conceive of before. So I think that this talk that I used to give about how consumers had one expectations and hospitals are really struggling to deliver it, I think that the hospital systems are kind of being forced to catch up right now in real time. And I think we're going to learn an awful lot about how much better we can deliver care virtually.
Love it. All right, Kristi, help us wrap up here on the CRM note. What's your take?
It's interesting. There was a word that jumped out at me that both Chris and Paul use, and that word is context. And I think when you think about healthcare, we so often immediately shift to all things medical and all things complex. And the reality is that a lot of the delivery of healthcare is really about aligning the value chain for what's the benefit to the consumer or the patient with what value they're getting out of it. So say, for example, you're going through a digital experience, chatbot, voice bot, analog phone, mobile, what have you, and you solicit information from that patient. Maybe the CRM is capturing that on the back end, but patients are very amenable to giving information. We do it all the time with Google search. We ask Google questions about some of our most private, personal situations. We research information because we know we're going to get something in return. And so as we design conversational experiences to provide value to patients, to be able to source information from them, but then also retain context and provide them directionality. Where do I go to get treated? When do I need to be seen? What do I do at home to take care of myself? When should I worry? How do I access a video visit? And so those types of access issues, by retaining that context, if we can, as we design these interactions and these conversational experiences with patients, we don't need to get into the medical soap notes of a provider to immediately provide value. If I know the patient's symptoms or a reason for a visit, or the patient will tell me, here's what I'm struggling with, or I don't know whether I should come into the clinic if I have this cough, or right now it's too dangerous for me to come in. And so I need to take care of myself at home. And, oh, you're going to check in on me to see if my symptoms get worse. That's fantastic. And so I think that's really the future, is identifying simplicity and elegance in what we can do. And so I'm super excited about that, because I think now that we're having widespread adoption out of necessity of these digital tools, folks are going to start to really understand them. And so there won't be a disconnect now between that consumer front end in the experience and then that medical care delivery on the back end.
I love it. All of these thoughts, and I appreciate all of them. This is just to round out our perspective and help us all realize there's a lot of questions that we're all trying to answer at the same time. And I think even just some of the keywords of context, of relevance, of trust, of experience, several of those words that I heard each of you sharing at various points during the conversation are very helpful and valuable, just to give us some focus points to start off with, and realizing that these are journeys that we're going to be going on for a long time. So I want to thank each of you, Chris, Kristi, Paul. Thank you so much for joining us. This series is produced by the Shift.Health Network, the infotainment media network for healthcare marketers to challenge the way of thinking and lead meaningful change. Thank you for joining us.